Thank you so much, Dr. Chandra, for joining us today as a renowned cardiologist. How does antimicrobial resistance impact cardiovascular patient care?
Yeah. So thank you very much. These are very important questions today, which are actually affecting the healthcare system and also the patients. So why it is important? Because once patients develop, or in general, we have antimicrobial resistance, a lot of antibiotics become ineffective. Even if we are giving it, they don't work. So that is why we are working towards a goal where the antimicrobial resistance, or basically the resistance of the bacteria towards the drug, is minimized or reduced.
Also, could you please explain to our viewers the connection between heart health and the growing challenge of antibiotic-resistant infections?
Yes, yes. Sometimes, as you know, that many diseases are affected. Heart is affected because of the infection, which is like infective endocarditis or septicemia, or sometimes when we are doing surgeries, complex surgeries, and also doing angioplasties, implanting pacemakers, etc., then we don't want any infection. And to have a situation where there is no infection, we have to take very, very strict precautionary steps so that the infection doesn't enter into the body. And even if it enters, it is actually should be effective to the medications which is available today.
Dr. Chandra, you've been an integral part of our campaign. So talking about NDTV Dettol Banega Swastha India, if you could tell us what steps individual can take to prevent the spread of antimicrobial resistance.
Yes. So this is very important, Ambika. The thing is that there are many, people who can actually get involved in this process. First, of course, is the patient himself, that he should not buy antibiotics straight over the counter on his own, because his doctor prescribed one antibiotic earlier and he will start using the same. And again, that leads to resistance. The second is the doctors who are practicing in the outpatients, in the clinics, in the nursing homes, should also not use antibiotics indiscriminately. And also indiscriminate use of higher level of antibiotics should be avoided. Because if we use the high level antibiotics now and the bacteria becomes resistant, then we will have no options left. And then the third thing is, in the hospitals, the steps which we take is, we have a policy, antibiotic policy, where we actually decide whether a particular level of antibiotic can or should be used in a given patient or not. Because if we start using the highest level of antibiotics for every patient, there will be very, very serious issue of antimicrobial resistance.
Thank you so much, Dr. Chandra, for joining us. It's always a pleasure to have you with us.
Thank you.